On this edition of Fulton at Work, the massive effort now underway by Fulton officials to deal with the new drug epidemic in the county, that being heroin. And we'll hear from one mother who has made this issue her life's work following her son's battle with heroin and subsequent incarceration. I'm Daryl Carver. We'll address this important issue next on Fulton at Work. Please stay with us. Welcome to our program. I'm Daryl Carver. Fulton's justice and government officials joined forces to combat what it now knows for sure is a major crisis in the county. In 2015, Fulton County's chairman hosted a series of crime and safety summits where parents repeatedly expressed concern about the heroin problem in the county. The Fulton County District Attorney was part of the summit and as a result commissioned a study to look at the numbers, and those numbers are staggering. The DA formed a task force to address this issue, whose main mission is to save lives. FGTV's Felicia Church starts us off.
In the judges' conference room at the Fulton County Courthouse, Fulton's district attorney brought together law enforcement, elected officials, legislative liaisons, and health and civic leaders to address what is clearly the new drug of choice, heroin, and now the new drug problem.
We know now that the rumors about the problem, those rumors have been confirmed.
The cheap, available, and deadly drug is sweeping through all parts of the county. And now those who are part of this heroin task force want to find a way to address the problem.
We talked about some important next steps and some action items that we could take to start to really seriously address the serious problem we have that's affecting our youth here in Fulton County.
What we're trying to do is raise a grassroots campaign to send letters and to make conversations started between here and Washington, D.C.
In January, D.A. Howard and Fulton Chairman John Eves released the results of a comprehensive study on heroin-related crime and deaths. The report showed that between 2010 and 2014, 154 were killed in heroin-related deaths in Fulton County. The study was released during a program at the Lindsay Street Baptist Church in the English Avenue area, also known as the Bluff. It's the same area where police and federal officials closed down known drug houses in 2015 and an area where most of the heroin sales are made. The DA said most of the buyers are from North Fulton. He's even received reports of parents driving their children to the area to buy the drug.
But the parents said to me, the reason that I'm doing this is to make sure that my child returns home safely.
Members of the county's Intergovernmental Affairs Division, state and local officials are also working to resolve the problem with legislation.
The thing that we're most excited about is that the federal government is realizing that we cannot solve this problem by mass incarceration. They're starting to look at it differently as a public health issue, as a public safety issue, and then lastly, as a criminal justice matter.
A move families, justice officials, and legislators are glad to see. Reporting for FGTV, I'm Felicia Church.
Thank you, Felicia. Kate Basha is part of the Fulton County Heroin Task Force. She's also with the National Incarceration Association and has dealt with this heroin issue firsthand within her own family. First of all, Kate, welcome to Fulton at Work.
Thank you so much. I'm really happy to be here and talking about this very important subject.
Now, we want to start by giving our viewers a little bit of background on how you became very involved with this issue. It starts, in your case, with the issue surrounding your son, correct?
Yes, exactly. My son Daniel was one of those kids that was heading down a wrong path through high school and using marijuana and other forms of opiates, Xanax and Roxy's. Kids were sharing Adderall and that sort of thing. And as a mother, I didn't really have a complete understanding of what that all was going to, where that all was going to head him. So eventually my son went from misdemeanors to a felony charge, and at that point gatewayed over to heroin. So my story really just starts with this crisis that my family had and the lack of resources and lack of help, and I was begging everybody to come to our rescue, and I found nothing and I found nobody.
Now, we mentioned earlier that Fulton Chairman John Eves hosted several crime and safety summits in the county, and you were part of those as well. Tell us about that experience and how it got us closer to this point.
Okay, that started when I saw a little blurb in the AJC, the Atlanta Journal-Constitution, that John Eves was going to host this or start up this Smart Justice task force or something, and I thought, oh my goodness, you know, they need someone like me on it because I'm in the trenches here. My son not only was a heroin addict, but he was facing a armed robbery charge. So he was kind enough to invite me to be part of that Smart Justice Advisory Council, and from that came about these town hall crime and safety summits. And the two that I was part of were mostly in the north part of the county. And when we were on those panels with experts, police officers, addiction experts, my mother like myself, the audience, a lot of the audience were my friends and other family members that I had met that needed help. So they came and they just wanted to talk about the one thing that was destroying our lives, and that was the heroin crisis. And I think District Attorney Paul Howard was completely taken aback by the conversations that we had at those meetings.
And about those conversations, what did the chairman, what did District Attorney Howard, the chief judge, what did they hear from those parents about heroin in Fulton County?
I mean, they heard the horrific stories of children that had died, young adults that had died. They heard the horrific stories of families still battling this active addict, which is a god-awful. These young adults and children become a beast in our own homes. And then they heard the stories of those that were incarcerated, like my son, as if that was the answer to the problem. So the stories, they also heard, you know, I think I remember one of them asking how many people had known of a young adult that died from heroin, and like almost the whole room raised their hand, and that really was quite an eye-opener.
The parents in the room, like yourself, what sort of help were those parents looking for as a result of attending those meetings and then working on these efforts following those meetings?
Well, the sad part is the parents didn't even know what kind of help they needed, but they knew they needed help. So I guess in the long run, they needed immediate help, urgent, immediate help. I have recently received a phone call from a mother whose son was in the bathroom, wouldn't come out. She needed they needed emergent, immediate help for their child. And then they needed a plan, some kind of long-term plan that, and especially if they get caught up with some kind of charges, they needed a long-term plan that didn't include incarceration, that maybe included residential treatment and those sorts of treatments.
Moving ahead, you began work with this task force that the DA put together. Give us a little bit more on your involvement with that and what you've seen coming out of that task force so far.
I think my involvement really is a connector. Because for the past 4 years I've been in this arena talking about the heroin crisis to everybody and anybody who would listen. I've also, that has engaged me with the leaders that are doing the work. I call them boots to the ground people, the master addiction counselors, the Georgia Overdose Prevention, Georgia Council on Substance Abuse, these types of organizations that are actually doing the work. And so bringing them to the table for the task force in order for them to come up with a collaborative plan, a really comprehensive plan, because it's not an easy plan. I mean, this is something that's going to take all-on efforts from every level of our community in order to correct the problem. So I think, again, a task force is a great thing, but we need to make sure that the right people are at the table.
With that group, what do you ultimately hope to accomplish?
A strategic plan, and that looks like, you know, what to do today, what to do next week, what to do next year with these young adults that are in an active addiction or in recovery. It is, again, a collaborative effort amongst not only government funding and programs, but also local .orgs that are doing the work. So this coming together, but it does need one person to oversee the entire thing that understands the complexities of opiate addictions. And if we don't have that kind of overarching person, I think we're going to end up spending money and not getting results that we need.
What have you thought so far about this group and just how the diversity of the group and the diverse backgrounds that these folks bring to this issue?
I think it's a great group. I do think we need to take this heroin task force and turn it into an advisory panel, if you will, and then allow a strategic board to come out of that with the true people that understand, again, all the complexities that are involved in order to get government funding for this area and create programs. So I think it's a great group. I love everybody on it. They all have definitely some form of expertise in which to add to the conversation, but we do need a serious board to take the next step.
Okay, we're going to take a break for now, but when we come back, we'll hear more about the campaign to address this heroin crisis, and we'll hear more about your visit to the State House. So please stay with us. We've been focusing our show today on the heroin epidemic and its impact right here in Fulton County. Kate Basha is on the Fulton County Heroin Task Force. Kate, the Fulton County District Attorney is trying to partner with many groups here in Fulton County, including our businesses and civic communities. Now, before we continue this conversation, let's take another look at how the DA is working with other elected officials on this issue and give more background for those who just joined us. FGTV's Priscilla Ortega continues that coverage.
Because I think that is what we have in our county. We've got a brief opportunity to maybe try to bring this problem to an end.
District Attorney Paul Howard told members of the Johns Creek Chamber of Commerce that heroin-related overdoses and deaths continue to rise in Fulton County, and in particular in North Fulton and northern suburbs, where about 53% of those deaths occurred.
My 26-year-old son is one of the 52 deaths in Fulton County last year. I found him the morning of April 4th. He passed during the night.
DA Howard says the fatalities will continue to grow unless something is done.
One of the suggestions that we discussed is distributing Narcan, which is a drug used to revise people from overdoses, distributing that drug to police departments, fire departments, and first responders.
Civic leaders gathered for a luncheon at St. Benedict's Catholic Church to hear how they can help stop this problem from getting worse.
Whether you see it in your day-to-day life, you're paying taxes to help combat the problem, and it raises the cost of law enforcement, and it's one of those costs that we just can't say no, we're not going to fund. We have to fund it to keep our community healthy.
The county started tackling the heroin issue head-on last summer with the Drug Marketplace Intervention. Program organizers gathered 19 alleged drug users and gave them the opportunity to participate in a federal rehab program. The next phase of the program involved demolishing several homes on English Avenue known for housing drug deals. The task force vows to continue these public information sessions to make sure this problem does not get even more out of hand. Reporting for FGTV, I'm Priscilla Ortega.
Okay, we saw Johns Creek City Councilman Steve Broadbent in that piece. Do you think the majority of leaders in North Fulton really understand how serious and how grave this issue is?
I think they're aware. I'm not sure that they are publicly speaking about it enough yet. A couple of them are maybe, but they're definitely aware. They watch the news, they read the paper, and they've all met moms like myself that have been in, to talk to them. But I don't believe they're publicly saying what needs to be said yet.
That being said, what do you think it will take for the entire community to really wrap themselves around this?
To acknowledge that it's here, that it is a crisis, that we are losing children, but that we can fix this. Addiction is a preventable, treatable, chronic condition. And if we don't understand that, then we can't do it. So we all need to be able to say that we know it's here and it's a crisis. And we need to be able to tell the families that we care, we hear you, and we're here to help you.
Now, as part of spreading that message, you were at the state capitol during the General Assembly session with the Georgia Justice Project. Tell us about the project and what you were at the General Assembly to do.
I went down there with them on their Enhance the Chance Lobby Day, which is part of the criminal justice reform agenda that Georgia has been actively working on since 2011. So I ultimately always support anything that we can do to reform our criminal justice system here, because if we start looking at the bigger picture, it all starts with our children and getting into trouble with addiction and misdemeanors and then over to felonies.
Now, you mentioned earlier you're with the National Incarceration Association. Tell us a little bit more about that organization and how it fits into this whole picture involving heroin.
The National Incarceration Association was formed because of what I've learned in the last 3 years or so since my son has been incarcerated, and the fact that he went in as a full-blown heroin addict and was detoxed on Fulton County Jail rather than any kind of treatment. He's not had any rehabilitation, any treatment. It's not just my son's story any longer, it's everybody's story, because when you learn what truly goes on in a prison, that the Department of Corrections frankly can't handle this fallout from these addicts, these mental health people. So it really does all work together very, very cohesively. If we keep giving the Department of Corrections kids like my son, they don't have funding, they don't have programs, they don't have anything to help them. What happens then is we just keep bringing home people that are sicker than when they went in, frankly. So I'm down at the state capitol talking about that. The National Incarceration Association is specifically designed for the family members, loved ones, and advocates who care about somebody that's incarcerated to say, we're here, we vote, and we pay taxes.
On that note, how much of an issue do you see the mental health component, when it comes to dealing with those people that are behind bars?
They go hand in hand. If your child, or if a person becomes a heroin addict and they did not have any mental health issues prior to that, they're certainly going to have them after, because they're stealing, they're lying, they're destroying their lives and families. So they become very, self-worth becomes destroyed, all of their things. But most often these young adults especially are self-medicating. And it's a very different world than when we grew up, that how these drugs are much more potent. So the mental health component is just a crisis as well. And once again, we look at the Department of Corrections, who we just basically allow them to warehouse these issues. They don't charge them, they don't sentence them, they don't convict them, they just get them. And they get them with no money and no resources. And we stand out here and say, that's okay, we'll turn our back on the fact that you've got that mental health patient who's a heroin addict for the next 20 years on a mandatory minimum sentence. It just can't work. It won't work, and it doesn't work.
On another note related to the heroin issue, I know the Board of Commissioners recently authorized emergency providers to have Narcan on hand. How key a part is that in this whole picture?
Well, that's so critical. We have one case of a young man, he's in that heroin report that the district attorney's office commissioned. He was revived 9 times. He's now a success story. He is in recovery for over 3 years. He owns a sober living home. And so was it worth saving him 9 times? Yes. A lot of people think that's disgusting. How dare he overdose 9 times? Well, the fact of the matter is he's worth saving, and Narcan can save lives. It does save lives. There's a lot of success stories that come out of that, so it's a critical part of the first step.
What is the concern level as far as where this problem could head going into the future if people don't really wrap their brains around just how bad heroin is in Fulton County right now?
I mean, it's not where is it? It is. It's heading out. There's younger kids starting on heroin. Every single day there's a new addict entering into the arena, and it's pushing into all parts of the community, not just our county, but all over our country. So it is heading, it's not heading, it is right now in our schools, in our 16 and 17-year-old kids' brains, becoming addicted to these drugs. So it's a crisis that's not going to stop unless we stop it.
Okay, Basha with the Fulton County Heroin Task Force, thank you so much for your time, and please keep us posted on the progress of your group and their efforts.
Will do, thank you.
Now, if you want to join the discussion about the heroin problem in the county and want to get in touch with the task force, you can contact the Fulton County District Attorney's Office. Thanks for joining us for Fulton at Work, and a very special thanks to our guest today. We want to connect with you online. Please check us out on Twitter, Facebook, and Instagram. I'm Darrell Carver, and we'll see you next time.